Hello, everybody, and welcome to the Hackers for Birth Justice kickoff event. My name is Soler Spellin. I am the Associate Director for the California Preterm Birth Initiative at UCSF, and I'm here with Lauren.
Hi, everybody. Welcome. My name is Lauren Newman. I am the Communications and Design Manager for the California Preterm Birth Initiative, and I'm super happy to be here.
So am I. We're so excited to have you all here to witness the first hackathon presented by PTBi and Twilio to develop tech solutions for Black maternal health. So during this kickoff today, you're going to hear from myself and Lauren about the Black maternal health crisis and how tech can make improvements. You'll also hear from Ms. Kimberly Seals-Allers, the founder of the Earth app, which is a perfect model to look to as we think of tech solutions in this space. And we'll close with Twilio representative Tilda Thurium on what to expect for this hackathon. So with that, we're just going to dive right in. So when we talk about this work, we like to remind everyone that birth is very much a universal experience. And I think we can all agree that it should be a happy and healthy time in people's lives. However, we know that not everyone has a chance to be born healthy and fully reach their full potential. Not everyone has access to resources and opportunities that allow their communities to really thrive. And Black communities in particular experience the heaviest burden of adverse or poor birth outcomes, which is a result that is due to structural racism and racial inequities in our society. And so what you're seeing here on the screen, these are just some statistics that many of us in public health and in research, we see time and time again. And they reflect the racial disparities that exist in adverse birth outcomes in our country, including preterm birth or being born too early, infant mortality, which is death before the age of 1, and maternal mortality, which is a pregnancy or birth-related death. And as you can see here on the screen, Black communities, which are the green bars, are experiencing these adverse birth outcomes at a much higher rate than other racial groups across the board. And of course, these outcomes, they have significant negative impacts that reverberate throughout our communities. And so just for some background, during pregnancy, every single week counts. Pregnancy typically lasts for 40 weeks. And so when a baby is born before 37 weeks, that is considered a premature birth. And being born too early is the leading cause of infant death. And babies born preterm who do survive, they can often face a significantly increased risk of cognitive disability, poor school readiness, and many other medical and social challenges. The impact, again, is felt for a lifetime by these children and their families, not to mention the emotional and financial tolls for the families. It's a serious disadvantage starting from birth, right? Not to mention potential and also life lost of the mamas and the babies who don't make it. And so I want us to just think about this true or false question just for a second. Black babies are more likely to die when cared for by white doctors. Is that true or false? I'm seeing some stuff in the chat. As bizarre as this sounds, y'all, this is actually true. Researchers found that Black babies are 3 times more likely to die when cared for by white doctors. And it is an incredibly disturbing finding, but this is the reality, and it reflects one of the many ways that racial bias and structural racism play out in our society. Historically, we are taught and made to believe that when things go wrong, it's actually our fault, the woman's fault, the birthing person's fault. You'll often hear things like, she started prenatal care late, or she didn't attend all her appointments, or the patient was non-compliant. But we need to instead take a look at the environment around our mamas, including the responsibility of our providers and the impacts of their attitudes, their beliefs, and lack of giving proper care. What we're talking about here is an issue of racial equity and birth justice. There is nothing wrong with Black women and birthing people. There's nothing wrong. It is the environment and structures around us and our overexposure to racism that is at the root, and is precisely why we not only need to take an upstream approach to address this issue, but we must get innovative and we must get bold if we really want to see change. And so, if you didn't know by now, we are in a maternal health crisis in this country. And I think some of you may have become aware of this national crisis as it's showing up more frequently in the news, of how stress, disrespectful treatment, and care and structural racism are at play in what's happening. You may have even heard celebrities and athletes speak on their experiences, like Beyonce, Cardi B, Serena Williams, Allison Felix, Tatiana Ali. These disparities that we see, they cannot be explained by socioeconomic status or access to healthcare alone. Black women from all walks of life repeatedly share theirs and their families' experiences, their mothers, sisters, aunties, daughters, and friends who share that they're not listened to, and their concerns are largely ignored or dismissed when they spoke up or told a healthcare professional about symptoms they were experiencing. And this results in compounding stress, fear. It results in unnecessary loss and preventable life or death situations and outcomes, really. Like, Black mamas dying from childbirth at a rate that is 4 times that of white women just because we're not being listened to or believed or respected. It's unacceptable. And so our communications platform, it's called Voices for Birth Justice. It provides information and resources, but it also lifts up stories of those experiencing these issues and those working to address it. Our executive director on the screen, Alexis Cobbins, shared about her own story delivering her son preterm. And she shared about how her doctor denied her pain medications during her birth because she didn't look like she was in enough pain. And when she asked a provider why a certain treatment was recommended to her, their response was, "You wouldn't understand." And Alexis shared that when she was being mistreated during her delivery, what she needed in that moment was for her providers to not be racist, right? Racial discrimination prevents Black mothers and families from receiving proper and equitable care. And we know that these experiences directly impact the well-being and health outcomes of both the birthing person and the newborn. And in the worst cases, again, can even result in infant or maternal mortality. For Cura for Moms founder, Charles Johnson, he lost his wife, Cura Johnson, after she bled internally post C-section due to neglect. And her death was absolutely preventable. When we go into a room or any virtual setting where Black women, Black people are present, and we ask if anyone has had a negative pregnancy or birthing experience or knows someone who did, people always raise their hand. It's too prevalent, and something must be done. We want to make sure that there are way more positive experiences happening than negative. And so there is hope. There's definitely hope. There's been a rallying cry and call for healthcare systems to address racism. There's been policy change, bills, acts requiring perinatal providers to engage in implicit bias trainings on a regular basis, bills calling to improve perinatal outcomes and address racial disparities in pregnancy and birth outcomes. And last year, President Biden signed a first ever proclamation marking Black Maternal Health Week and calling for all Americans to recognize the maternal health crisis and the importance of reducing our unacceptably high rates of Black maternal mortality and morbidity. And it's time. The time is now to start doing that. And we start not only listening to, but investing in, right? And centering and uplifting those who are most impacted by this issue in order to create meaningful change. That is what we have to do. And so how does tech fit in? Why tech, right? Why are we here today? I think we can all agree that technology has made modern life so much better, right? Look at us all here today doing this. We know that technology has made modern life better, and it's often used as a reliable tool to drive innovation and improvements to complex challenges. And so there is a duty here, I think, a call to action, if you will, and we're responding to that call, right, Lauren? We're responding
absolutely.
to that call, right? With this event with Hackers for Birth Justice, and our hope is that introducing technology can really revolutionize solutions and take us further than ever before. And so, Lauren, as a mom yourself, why are you excited about this hackathon, and what do you think is like the most important thing to focus on?
So Lair, as you're saying, everything is pushing towards more progression in technology. Everything around us. Everything has an app. Everywhere I go, do you have an app? Do you have an app? No, I don't even have to ask anymore. It's on their door. It's at the kiosk. And so I feel like we should be focusing on representation in these apps. And one of the first things that when I was pregnant, one of the very first things that I did was download an app to track my pregnancy. And when I went into these apps, super excited, but saw no representation. I didn't see me. I didn't see anybody like me. Um, you know, the two popular ones that I was on at the time were What to Expect, and I think Bump was another one. And um, I just wanted to see more representation. Like even from one of the apps had a 3D model of kind of what your baby looked like growing in you, which was so cool, right? But it was like a tannish pink baby, right? And and you're kind of like, can I at least get an option for skin tone? Can I at least get, I already have to deal with lack of representation enough on like the baby care products that I was buying, the diaper packaging, all of that. That you have to chalk that up because I need that, right? That's a necessity. But these apps very much can be making strides towards representation. And I feel like that would be a huge focal point.
I agree. If we can change our skin tone on Zoom with our like thumbs up, like why can't we have that with some of these apps? I really believe tech can take us further, and not only in representation, but like some of the words that you see on the screen, right? Accessibility, accountability, respect, cultural concordance, partnerships, communications, even training. There's so much that could be done. And so we're excited.
Lair, also, I just want to say, when I say representation, I do mean visually, of course, but I don't know about everybody else, but I look up who made the apps. I look up the companies who created the product I'm buying. And if I go to your team page and I don't see representation there, I feel some type of way.
Right.
I feel some type of way. So I want to see representation in the software developers as well.
Mm-hmm. Absolutely. Absolutely. That's what we're talking about here, right? That's super important. I'm really glad you brought that up. I mean, more to share. There's so much to share, but the origins even of this hackathon is surrounded around that theme. So let's talk about our objectives. I'll pass it to you, Lauren.
Yeah, so some of our objectives for this hackathon is to increase awareness about the Black maternal health crisis, develop innovative solutions to combat challenges impacting Black mothers and babies. And we also want to build relationships between the fields of technology and birth justice. And that last one, I feel we're asking a lot. It's a lot, but this is why we're here. We're bringing in other brains. We're bringing in other brains.
Yes. I mean, come on. Can you imagine what we can create when we bring fields together? It happens all the time. You need diversity. It makes things better. And so when I say we need to be innovative about this issue, this is 400 years in the making, right? That has led us to our reality. We have to get creative. We can't keep doing the same things and expecting a different result. We have to get creative and innovative. And so I'm so excited. I'm so excited that we're here. We're doing that. That the field is doing that. There's so many examples too that we can look to. And so just to get our hackers started a little bit, we just want to provide some focus areas and some sample prompts to get the creativity flowing. At our organization, we work with and communicate with Black mamas all the time. And so the focus areas we are highlighting here, they're coming directly from Black moms and families and advocates who have shared where the attention needs to be. And so that attention needs to be on respectful care, right? That is free of anti-Black racism. I think people think they are providing respectful care, and then bias comes in and the situation changes, right? The focus needs to be on effective anti-racism trainings. It's not enough to just attend a one-off implicit bias training or culture. Like, it's not enough to just do that and check the box. We need quality. There needs to be a focus on anti-Blackness in particular, because we need to get specific. There needs to be some kind of quality improvement going on with the trainings, making sure they're effective. More representation in healthcare, exactly what Lauren just shared. This is something that we hear from our moms all the time. I want representation. I want to feel comfortable. I want to feel seen. Uh, better data. Better data. I'm not gonna go all the way. This is what the pet peeve of mine. The way that we collect data about health, I take issue. I take issue with it. But I'll point out one thing. We are not going to figure out how to solve this issue by asking folks whether or not they were able to get to their appointment and see their provider on time. You're not asking me questions about how was my experience, did I go through X, Y, and Z. And we need to collect better data, and we also need to be disseminating it and translating that data to the public better. Quality perinatal and postpartum support. We have to take care of folks from before the pregnancy, throughout the pregnancy, birth, and after. That fourth trimester, I hear that all the time. There's not enough attention to that fourth trimester. Right? Like, where's the gap for that? And cross-sector collaboration, which is what we're doing right now. Moms and families, they know that it's going to take more than just, a meeting or coming together to talk about the issues that are going on. It's going to take all of us. This is an issue that impacts every single one of us. And so we all need to be in this. And, we truly believe if we're able to make a stride, right, in the experiences that Black women and birthing people are having, it's going to help everybody. It is going to help everybody. When you're able to make improvements on those experiencing the heaviest burden, you are helping everybody. And so these are just some of the focus areas that we wanted to share with the audience, but also with the team, so that you could just get the vibe. Okay. And also, bear with us, this is a lot. We just wanted to also provide some scenarios. Nothing is written in stone. These are just examples, just so that everybody knows. All the hackathon teams will have a subject matter expert to consult with, but also to develop and design with. They will also have lots to share as well. These are just some examples, again, to get the creativity flowing. And the question we want you all to think about is, how might we improve these situations using technology.
Absolutely.
Lauren, you want to share one of the scenarios or prompts?
Yeah, sure. So we tried to categorize this a little bit into some themes for you guys. So the first one would be data collection. A team of birth justice researchers are sharing a survey meant for the Black community with a cash incentive. How can they filter out bots and false submissions for accurate data? So some of these scenarios are coming from real life scenarios that we've had, and we're getting back lots of bots. I think we had like one situation there was like 1,000 emails, and we were like, "Oh my gosh, yay!" And then we get in there, and we're like, "These are all bots." So, how can that be improved?
That's a good one. That is really a good one. I'll read another one. A Black woman recently gave birth, and her provider gives her a website to browse for various support services, right? She's looking. None of the programs listed appeared to serve Black communities. And after several failed Google searches and phone calls, she gave up. This is something that happens quite a bit. You're looking for a service or a program, something that you need, something that can help you. And you pull it up and you're like, ooh, actually, I don't feel welcome, or I don't know if I'm gonna have the best experience. This is not vetted. I'm not sure if I want to actually go here, right? And so if we are not able to increase the amount of options that mamas have and make sure those options are actually quality or can actually meet their need, then we're failing our moms. We're failing our moms if we're unable to do that. And I just want to point out here too, it's not like navigation doesn't exist. We all have Google, right? We all have different sort of platforms where we can browse for a specific thing. But if the options are limited or are not meeting Black mamas' needs, for example, then we're failing them. And so is there a tech solution perhaps here? Let's do another one.
Sure. So this theme would be quality of care. A pregnant person is being monitored at the hospital for high blood pressure. Without speaking to them first or checking their records, the doctors assume the patient had not attended their regular prenatal appointments. After deeming the patient challenging, they speak amongst themselves and behave dismissingly toward the patient. I know this one is hard. I know you're listening to me read this one and be like, how am I going to solve this with technology, right? But we're in the era of Twitter, and we're in the era of Instagram, and wouldn't believe the amount of stories that I've heard on medical experiences on these platforms. So how can we improve this through technology?
Yes. Oh my gosh. Yes. This is just sometimes reading these prompts, these scenarios, these are real life examples, y'all. We are not like just making stuff up. These are real life examples that happen every day on a daily. You would be shocked. You would be shocked to hear the stories that we hear. And I feel like if we can come up with tech solutions, like if folks are talking about how to get Amazon deliveries like flown in on drones, we can come up with solutions to things like this. There is no limit to what we can do. And so I'm so excited to be able to get creative and think through, how we can come up with some solutions to these. And it may not be, I think this is a good opportunity to share. It may not be a direct solution. It may be something that's intermediate. You know what I mean? So a lot of what we're talking about today, some of these are social issues. And so thinking about, a tech solution to a social issue can sometimes be challenging. But again, like Lauren just said, we come up with tech solutions for social interactions and things all the time. So I think it's possible. But I just want folks to just get those creative juices flowing because there are things that we can do. And so we'll read one more. Shantae is a new mom experiencing a lot of stress. Her family has no savings, so she and her spouse must return to work sooner than desired. Their parents are unable to retire, leaving no support for childcare or household management. Shantae's baby was also born premature, so the idea of putting her in daycare in the first year is very daunting and very scary. This, unfortunately, is another one that is super common. And in some recent work that we did, again, like this fourth trimester, it can often be one of the hardest because the policies and the way we have structured our society is such that we don't have a lot of parental time off or paid parental leave. And can you imagine if you don't have enough resources or funds to support somebody to do childcare, or a parent, or somebody in your family that can watch your child? You're going back to work, and within, what is it, like 6 weeks? I mean, that can be.
And that depends on how you gave birth.
Right. Right.
Yeah.
And then if you're in the NICU for months, some mamas are in that NICU for, like, their baby is there for months. This is something, again, like another scenario or prompt that we want folks to just think about. The scenarios are endless. So what we're gonna do now is move forward. Yes, I saw somebody put in the chat. Can we share these? Yes, absolutely. We'll share them out via email, I believe. Don't quote me on that. So we are actually going to move towards showing a couple of videos. We may have Kim join us, but in the meantime, we wanted to share a couple of videos. I mentioned Charles Johnson earlier, and he has a story of his own again, about how he lost his wife. And we want you all to listen to that story. And then we will also, if we don't end up getting, oh wait, you know what? I think Kimberly is here, which is amazing. So I'm actually going to pivot and introduce Kimberly. So hold on, let me just start over. Kimberly is here. We are excited. I want to introduce Miss Kimberly Seals-Allers instead, okay, who is an award-winning journalist, a 5-time author, international speaker, and of course, the founder of Earth, which is a Yelp-like digital platform to address racial disparities in adverse maternal and infant health outcomes. And we are just so honored and have so much gratitude for Kimberly. Thank you so much for joining us. I'll turn it over to you.
Wonderful. Thank you so much for having me. Hey, everyone. This is such an exciting experience. I first kind of launched Earth at a hackathon. And so I'm excited around this idea and this momentum that we can bring to creative problem solving and bringing our community-centered designs and solutions into this kind of platform. So I would love to just share a little bit about what Earth is and what we're doing and why it was so important for me to be here. I am joining you from Detroit, where we just had an event here. And so I'm grateful for the opportunity to be able to let Zoom have us in multiple places and at different times. So just to tell you a little bit about me, I am a journalist by trade, as was mentioned. I was a senior editor at Essence for many years, and then became a mother, and everything shifted. I became incredibly passionate and interested in what I was learning about the disparities in maternal infant health. My very first book, The Mocha Manual to a Fabulous Pregnancy, came out back in 2007, really looking at how we could learn what was going on in the lived experience of Black women that could be contributing to these disparate birth outcomes, right? And so kind of writing about birth and what was different for us, and then breastfeeding. I am also the co-founder of Black Breastfeeding Week, y'all. So August 25th to 31st, I hope to see everybody celebrating. And then really understanding, how do we use our stories? And for me, hacking this issue was around ways that I could use my passion for storytelling, my commitment to community-centered solutions, and bringing those together to a digital platform. So Earth is, which is, first of all, Earth is like the word birth, and we dropped the B for bias, so it's IRTH. It is the first of its kind Yelp-like review and rating platform for Black and brown women and birthing people to find and leave reviews of their OBGYNs, birthing hospitals, and pediatricians, right? And so we are a dual market app. On the front end, we give our community an ability to see how other people like them rated and reviewed a hospital. Many times you don't know what happened to me, and I don't know what happened to you. And this is happening even in our community. But if we have a digital platform and technology to share our experiences, then we can use that in our decision making. We can know what other people like us experience, right? And then on the back end, we turn those reviews into data to work directly with hospitals, payers, and providers. How can they learn from our lived experience, right? Instead of waiting for another maternal death to analyze care, right? We don't need another Kira or another Amber Rose Isaacs or another Shaisha Washington, of all the other sisters that we've unnecessarily lost to this crisis. And so how do we turn our lived experience data into ways that we can work directly with hospitals, payers, and providers? We actually have a hospital pilot here in Detroit. We've just signed one on in Philadelphia, and we're excited about expanding in California and across the country. And so we're here to bring the power of technology to our community, as well as being able to make sure that we can live out our birthright, which is to birth without bias. I wanted to just share a few things. Can I share screen here? Oh, I can. Hold on. Whoops, that wasn't what I wanted to share, guys. You don't want to see that. Hold on, let me get the right tab. Just to show you a little bit about our functionality and the way that Earth works, so that you can see for yourself and check out our screens. And okay, I think we got it right now. Let's see, we can get this to cooperate. All right, cool. Now let me share this. And if you have any questions, or if you've used Earth, let me know in the chat. We've been having a great experience here, getting more folks to leave reviews. So I'm just showing everything, but ignore my 15 million tabs, y'all. There we go. Okay, so us living out our birthright to birth without bias, for us to share reviews, as I mentioned, and for us to, first, when you come into the app, you do need to create an account. We need to know that you're a real person. And so you can verify your account by email or text message, just like many other apps. We'll send you a code for you to verify yourself as well. And then you can get into our main core functionality. You can leave a review, or you can search for reviews. You can search by zip code, you can search by city and state, you can search by hospital name. And then we also have some amazing content that we're excited about to really help you around your pregnancy and new parenting journey. So if you want to leave a review, we're going to ask a few personal details. This really helps us create better data for us to know more about who you are as a person, whether that includes your family size, your sexual orientation or gender, as well as some other things. And then we have three types of reviews, really. One, the birthing person can leave a review, or we accept reviews from fathers and partners. Anyone who was there as a partner to the birth experience can leave a review. And then we accept reviews from birth professionals, doulas, as well as midwives and nurses, right? Really wanting to bring this 360 perspective to the hospitals as we're generating this data, but also for our users as well. We actually have a special icon in the app that'll show you when a doula has left a review, because we really want you to pay attention to that review, knowing that doulas may see a number of births at a particular hospital. right? And then we it'll tell you when you see the review at the end who has left the review, their overall ratings around did they feel like their race or ethnicity impacted the quality of care they received, as well as reading more details, right? One thing I love about Earth reviews, I think because people know that these reviews, they are moderated, they are anonymized. So, and we do have to have a certain number of reviews to show you reviews. So if you put in a zip code, if it doesn't show reviews, sometimes you'll get a message that we don't have enough to show because we want to keep our community safe. So we have certain levels that have to be met so that we can protect everyone's identity because our reviews are anonymized. And then, we spend a lot of time in our community, just like we're here today, really getting out, speaking to families, hearing their experiences, letting them use the Earth app as a platform to search. We met a mama just in New York who was talking about, she was reading the Earth reviews, and that helped her understand what was possible at this hospital, what things people were allowed to do, what things people have more difficulty having happen. And this was really helpful in her formulating her birth plan. And then we'd love for you to stay connected to what we're doing. You can use this QR code. Please follow us on social media. Our work with hospitals continues to expand, and we're excited about the next phase. But ultimately, Earth only works if we use it to leave our reviews. And that, for me, I would love Earth to be a model of what we can do with our power of our stories and the power of technology for us to leverage, right, what we know we intrinsically have, that power. But technology really allows us to scale it, and that we are driving accountability and transparency. Many times the health systems have been allowed to operate in secret databases and in behind closed doors, but we have the power of technology can drive transparency, right? And accountability. And that's what the move for birth equity really needs: more transparency, more accountability, less asking people to change, because that hasn't worked thus far, more using technology to drive that change by holding folks accountable. So I'm super excited and so honored that I had a chance to share. I'm looking forward to learning more about some of the ideas and innovations that are coming out of this hackathon. And thank you so much for having me. I'm happy to take questions if that's okay.
Hello. Thank you so much, Kimberly. It was amazing to see an example of, using technology to address disparate birth outcomes. And thank you, Lauren. Thank you, Solaire. My name is Tilda, and I'm excited to talk to you about Hackathon Logistics. If you are not on a hacking team, you can feel free to drop out now, but please do join us for the demo presentations tomorrow at 4 p.m. Pacific to cheer on the teams, see what they've built, and see who the winner is. So I work at Twilio, and part of my job, I run hackathons. But most of the time, the hackathons that I run do not have this much of a social impact. So this one is really near and dear to my heart. Thank you so much for being here, spending time with us. Let's talk about what to expect. We do have a code of conduct for this event. The short version is that we want everybody, regardless of race, gender, sexual orientation, religion, body size, gender identity, and expression, no matter who you are, you belong here and you should be treated with respect. And if you see or hear anything that makes you uncomfortable, please flag it to any of the hackathon organizers and we will take care of you. So the event schedule, the kickoff, you were here. And then tomorrow, each team will be building in individual Zoom rooms. And each team is made up of cross-functional people with different skill sets. But each team includes at least one subject matter expert because I'm a developer and, I and most other developers in the world have this tendency to think we know everything just because we know how to code. And that's not how we want to run this one. We want to center the people who are most impacted by the problem. So, please work very cross collaboratively. Everyone on the team has something to offer. Brainstorm, talk through ideas, pick one, and then start building. And then you're going to build all day. And then what we really recommend is pencils down or, code editors down, as it were, in that last hour. because you're going to get the chance to present and show off what you built, because the product of a hackathon, it's not just what you learn, it's not just the prototype that you build, it's the story that you tell about what you built that also matters. So pencils down, actually, rehearse your demo at least one time, and we'll give you a presentation template so you know what you should cover during that demo. And then at the demo ceremony, each team will have 3 to 5 minutes to show off what you built, talk about it, and the judges will decide who's the winner. And then after that, optionally, there is an in real life happy hour for folks in the Bay Area. And if you would like details on that and you don't have them, let me know. So while you're building, as I mentioned, each team will be hacking in an individual team Zoom room, work as collaboratively as possible, center the people most impacted by the problem, try to get a minimum viable piece of code doing something up on the screen as quickly as possible, and everything else will flow from there. Take breaks when you need to, if you need to step away, as long as you're communicating with the rest of your team. This is not a college hackathon where you stay up all night eating terrible pizza. Don't worry too much about making your code perfect. That's not what hackathons are about. And, have fun, enjoy yourself, get to know some new people. In terms of judges, we have Kimberly, who just, demoed the Earth app to us. We have Natasha Cavanaugh, who is Vice President of Social and Environmental Impact at Twilio. We have Jeff Lawson, the CEO of Twilio, NBD. And we have Alexis Cobbins, the Executive Director of the California Preterm Birth Initiative, who will be evaluating the demos based on social impact. How well does this demo address the problem of adverse birth experiences? Technical feasibility. How hard would it be to get this into production? Did you have to do any clever hacks to get it running? And cultural relevance. How well does it represent the audience we're trying to reach and, fit in with that look and feel wise and representationally. So the winning team will receive $3,000, which was gifted by the Snapchat Women's Employee Resource Group. Thank you so much, Snap. We love you. And then ideally, we'd love to continue development of the winning app, and we're working on securing funding for that. So, with the winning team, we'll just keep the conversation going about how that's looking. So this is a free event. As happens, sometimes people don't show up. So if you show up tomorrow and you're the only person on your Zoom, we will find you another team. Email me at the address shown there, and I will find you another team to work with. If you're missing a calendar invite for either the demo ceremony or your individual team Zoom room, let me know, and I can also hook you up. And other than that, I am going to pause and ask, does anybody have any questions? I can't hear you, so you need to drop them in the Zoom chat if you do. Going once, going twice. Starts at 9 a.m. tomorrow, nothing this afternoon. That's a great question. So you could meet up early if you wanted to with your team. Nothing is stopping you, but yes, correct. It kicks off, things officially get started tomorrow morning. Yeah, and then tomorrow you'd start with ideas. The folks at the California Preterm Birth Initiative have given you some really thoughtful starting points, which we can share out via email to get your creative juices flowing. Yeah, come up with some ideas, pick one, and start building. You don't know the people on your team. Yeah, this is an opportunity to get to know one another for folks who didn't sign up as part of a pre-existing team. So cool. What other questions people have? 9 a.m. Pacific. Yes, that's a good call out. Excellent. Well, thank you so much, everybody. Thank you for spending time with us. I'll be popping in and out of your Zoom rooms tomorrow just to see how things are going. If you need help, if you need anything, please don't hesitate to email me in the meantime. Thank you, and we can't wait to see what you build.
Actually, is it okay if I say something real quick? Or is that, can y'all hear me or no?
Yes, we can hear you.
Okay, thank you. I just want to make sure. So if we're unclear on what team we're on, would we email? We would email you, yes?
Yes, you can email Tilda.
Okay, thank you. I just want to make sure because I think there were some questions in the chat around what if you don't know your team members? And I think the intention behind that was what if I don't know what team I'm on potentially? So I just wanted to be able to kind of honor that maybe that might be the question. So thank you.
Thanks, Yvette. I think we're all good to go, and we look forward to seeing everyone first thing tomorrow. Thank you all for joining us today.
Thank you. Thanks, everybody. See you tomorrow. Woo!
Thank you. Bye.
Go team.
Wow, go team two!
Team two.
We did it. We did it. Woo, woo, woo.
That was amazing.
Chris, we need you all the time. Like, what are our Zoom meetings going to be without you telling us when to go live and clear?
I actually have a quick question, if that's cool.
Yes.
Oh, okay. So I liked having the access, well, being able to see the prompts and stuff, but will we have access to kind of like what the scoring rubric will be? Because I'm still a little.
Process tomorrow-ish, or are we just going straight into our team groups?
Sorry, we are on two
Four.
different platforms.
Four, right?
Whoever asked that question, the scoring rubric is actually on the main website. And Tilda walked through them a little bit earlier. They're scoring based on social impact, technical feasibility, and cultural relevance. I'm unclear if it is more detailed than that, but I hope that is helpful. Those three categories is what the judges will be scoring based on. Does that answer your question?
Yes, thank you. And I look forward to seeing y'all tomorrow. See ya.
We do too. Thank you. See you tomorrow.
Bye.
Bye. Carly, you didn't have any additional questions, right?
No, I didn't. Sorry.
Okay, we're all talking in the other platform. Sorry.
My Zoom like crashed towards the end of that, so I was trying to just get it back. That's okay. It was I just couldn't see the screen, and so that's why I joined on the phone. But
Okay.
great job. That was so amazing.
Thank you. Can you send us the recording today by any chance? Is that possible?
Yeah, it should be. Let me go ahead and stop recording, and then I am